In Berlin at Charité, we oversee a cohort of more than 70 patients with Neuromyelitis Optica spectrum disorders, and we do clinical research in these patients. We work on improvement of diagnostic tools to diagnose Neuromyelitis Optica, to make an accurate distinction, for example, from multiple sclerosis, with the help of novel imaging techniques such as magnetic resonance imaging or optical coherence tomography. The idea or the technique behind optical coherence tomography is that you transmit near-infrared light to the retina. This is backscattered from the retina by the various layers, and with some complicated mathematical algorithms you can put a 3 or 2-dimensional image of the retina together, and from this image you can derive retinal measures of, for example, axonal loss, ganglion cell loss, and so on. When it comes to OCT, optical coherence tomography, this is a very novel technique to image and to monitor the loss of retinal axons and neurons. With the help of OCT, we see distinct damage patterns in multiple sclerosis versus neuromyelitis optica. For example, following an optic neuritis in multiple sclerosis, there is a typical localization of the damage more to the temporal area of the visual field of the retina, and while in NMO there is a more even distribution of the damage. The entire area of the retina that is covered by this technique is reduced, is damaged, and to a much bigger extent, for example, than in multiple sclerosis. So with the help of other techniques, plus MRI, plus OCT, maybe lab results, we may help with a rapid distinction of these two conditions.